A supplement that one can take and it will help boost the person's system for easy or faster pregnancy. We have a lot of supplements, and first of all, if you are preparing your body for pregnancy, you need to go to the hospital to check or test for infections. So if you realize you have infection in your system, ensure that first of all you treat infections, because when infection is not treated and you try taking all these supplements to boost your system for pregnancy, the infection might terminate the pregnancy at early stage or might bring a lot of complications in your pregnancy. So ensure first of all you treated infection before planning for pregnancy. And also you can be taking coenzyme Q10 to prepare the system. You can take folic acid, selenium, omega-3 oil, evening primrose, vitamin E and D. Sometimes you can take vitamin B complex, yeah, the whole B complex. We have supplements like that contains B, E, K, all vitamins in it. And also you can eat a lot of vegetables. So instead of eating much starch or much carbohydrate, ensure that you involve a lot of vegetables in your food. You can also take much fruit and ensure that at least every day you take much fruit in your system, and also ensure that you avoid stressing. So eat well and sleep well. So what are ways that one can prevent pregnancy? I told you earlier, pregnancy mostly occur through sexual intercourse. So one way you can prevent pregnancy is by abstaining from sexual intercourse. And also we have oral contraceptive pills, um, these emergency pills that can be taken when you know you have affair and it's in your ovulation or it's in your unsafe period. And we also have intrauterine device, that is IUD, a device that is inserted at the entrance of the womb that prevent pregnancy from occurring. We also have contraceptive implants, we have contraceptive injections, we have morning after pills, we have sterilization, we have diaphragms, and we have contraceptive rings. So let's talk about complications of pregnancy. And when we talk of complications of pregnancy, what are we trying to mean? It is when pregnancy is not well planned or when carefulness is not taken during the early stage or even in the middle of pregnancy. What are the signs and the things that leads to it? And it includes infections when you don't take care of yourself well during pregnancy. It's likely you will get infection, and infection can even terminate the pregnancy, especially at the early stage. Also, gestational diabetes. When you want to get pregnant and you don't prepare yourself well, but you eat anything and anyhow, you can get gestational diabetes where the insulin production inside of you is released more. And basically this thing goes off after you have given birth. It doesn't really stay long, so fine. And we have preterm labor where you give birth early before the EDD, like the due, the time you are supposed to give birth. Some people, it's in the family, it's congenital, it's a hereditary something, and sometimes too it's due to an activity you involve yourself in and you will lead to that. And also depression and anxiety. One of the complications is depression and anxiety, and it's when a pregnant woman is found thinking so much, getting worried so much, being anxious and stuff. If you don't take care, it will lead you into depression and it will affect you and also the baby inside of you. Ectopic pregnancy. Ectopic pregnancy is not really planned, but it happens when a pregnancy occurs outside the uterus. Or outside the womb. It's sometimes, as I said earlier, it can be congenital where it happens in their family. It's a family history, or sometimes due to a sickness or something. and also miscarriage. Yeah, maybe you involved in vigorous activity or something, and it will lead to a loss of the pregnancy. That is miscarriage. And also stillbirth, where the child will die even before he or she or the baby is brought out or given birth. We call it stillbirth. It's also complication. And also high blood pressure. It could be due to the pregnancy, or it could be a habit you were doing or some food you were eating that lead to high blood pressure. And the high blood pressure normally lead to preeclampsia. Yeah, another dangerous complication. And also you can have pregnancy loss, especially at the early stage. Yeah, when carefulness is not taken, you can have pregnancy. So I'm coming to teach you how you can do self-test about pregnancy at home. When you, first of all, missed your period and you suspect it could be pregnancy because you know you had unprotected sex or you had sex during your ovulation, and you want to do a self test, I'm coming to show you the process you will need. Mostly, using a pregnancy test kit, you won't easily detect it in the first week or few days. It normally reads from 2 weeks and above, so ensure that at least if you want to do the test, it's 2 weeks and above. Even sometimes 2 weeks it won't read unless it's 3 weeks above. So I'm coming to show you. So you first of all go to the pharmacy as usual and you get your pregnancy test kit. Always, I keep telling you, when you buy a pregnancy test kit or any test kit you buy, ensure the expiry date is intact. So with mine, the expiry date is October, that is 10th 2024, and we are already in 2023, so I think mine is intact. And you will collect sample of urine. Yeah. Normally we recommend early morning urine, your first urine in the morning. Yeah, that's what we recommend. So you will ensure your test kit is in and ready, and also you cross check your expiry date and you know it's intact, and you've collected a sample of your morning urine as I've collected mine like this, and you are seeing. You open the test kit like this. Inside the test kit you will find it in it this way, and also you will find this thing in it. This is the one you use to collect the urine. So I'm collecting it like this, and you will drop it out here at the first place, the round place over here, not here. Here will be the place reading for you, so you will drop it out here. So as you can see, I will collect some of my urine. I drop it over here, few drops, and then I will leave it to read. So when I dropped it, have you seen how it's going? Yeah. So I will then leave it for it to read. So after we waited for about 5 minutes, our pregnancy test kits read. Mine read, yeah, and that's how it read. Yeah, it came negative, meaning I'm not pregnant. Yes. If you test and the line becomes 2, meaning it's positive, or even if it becomes 2 or it's fainted, and it's positive. And sometimes too you might check and it will be 2, but it's PMS that is causing that. So as you check like this, you can go to the hospital to confirm. Yeah, but the self one you can do at home when you are exhibiting all the signs and symptoms. If you enjoyed this education about pregnancy I have given to you, and I will entreat you follow all my social media handles with the name Reno Inyame, so that you always get more health tips and education from me. Thank you and take care of yourself. Love you all.